They either have a silver filling that they could fill that cavity with. They could have a composite with it, which is a resin tooth colored filling. And if you would like, you could have a porcelain, which is a harder material than the composite, or a gold filling, which goes right in there, that is very kind to the tooth. So that is actually one of the better material that you could use for your teeth is gold. So now, as we go through this process of removing the cavity or removing an old filling that's breaking down, we go ahead and use a drill to make sure that we can get all the decay and the old filling out, as you can see in this video. And after the cavity is placed in with the composite, sometimes we could go ahead and layer this and use another material before the composite comes in. We build it up with a material, and then we put up the composite right on top of the buildup, so that when you are using the tooth, it's not going to wear down as easily. Well, in this video, we are going to go through the process of getting a filling, restoring a tooth that might have a cavity with a broken filling, or a broken filling with a cavity underneath it. And so most patients, when they come to the dentist, they are not sure of what the procedure entails when they're going to have a filling. So the first important part of this procedure is making sure that we are gonna get the tooth numb. There's many ways to numb it, and in this video we are gonna isolate that tooth to numb up that one particular tooth. And they don't have to have the whole jaw numb, but in this case we're just gonna numb up one tooth, because we're gonna be working on the first molar on the lower left. And as you can see here, we are gonna numb up that one particular tooth right now. So now during this process, we have to also be able to isolate this tooth. Isolating means that it is gonna be free of saliva around it when we're working on it. This is very critical when we are filling the tooth with the filling material. In a cavity, and when we're doing a cavity, patients have options of what type of material they could go and fill that cavity with. They either have a silver filling that they could fill that cavity with. They could have a composite with it, which is a resin tooth colored filling. And if you would like, you could have a porcelain, which is a harder material than the composite, or a gold filling, which goes right in there, that is very kind to the tooth. So that is actually one of the better material that you could use for your teeth is gold, but nobody likes that gold colored material. Most people like the tooth colored material, so that they could go ahead and look like they never had a filling in there. So when we're doing a cavity, we're getting that tooth numb, we're isolating that tooth so that there's not a saliva there when we're filling the tooth, and also it'll keep that area clean. So now, as we go through this process of removing the cavity or removing an old filling that's breaking down, we go ahead and use a drill to make sure that we can get all the decay and the old filling out, as you can see in this video. The second part, after we've taken out all the silver fillings that might be there, if it was an old silver filling, or if it was an old composite filling that was there and there's cavities in there, we've taken out all the cavities, all the old fillings. The second thing that we do now would be acid etching this tooth when we could get this tooth ready to accept a new filling. And in this case, it's gonna be a tooth colored filling. Now, once we get that acid etch, we are gonna put bonding agent on that tooth, around the tooth where the material is gonna bond to with the tooth. After the bonding agent, you will see the light shine on this tooth, and what the light does, it sets the material so that it will accept the new filling material, which in this case is gonna be the composite. So what we do is we go ahead and acid etch it, which roughens out the tooth. We go ahead and put some bonding agent so that the material that we put in will bond to the tooth. And then after the bonding agent is cured with the light, you'll see that the composite material that's going to fill the cavity is placed in, and after the cavity is placed in with the composite, sometimes we could go ahead and layer this and use another material before the composite comes in. We build it up with a material, and then we put up the composite right on top of the buildup, so that when you are using the tooth, it's not going to wear down as easily. So in this case, there's going to be a layer of a buildup material, and there's also going to be a layer on top of that that is harder for you to wear down. So when we go ahead and put a composite filling material, it could be one type of material that is composite, or two separate material that builds it up, and then put another material right on top of that that is a harder material that you are going to be biting on. So once we've got that in place on the tooth, this is going to be light cured again to make sure that the material sets. And then after the light cure, we are going to go ahead and adjust the bite, check the bite with an indicator to make sure that we could take out any high spot on this tooth, so that when you go home and the anesthetic wears out, the tooth feels as comfortable that it was when you first started. So what we do at the end is we go ahead and finish and polish the tooth so that the bite is right where it used to be when we started. And after that, the procedure is finished, and all you have to do is wait to make sure that the bite is in the right place when you get home, when the anesthetic comes out, and so that when you go and eat food, eat something to chew on, it's not going to be uncomfortable. Make sure you talk to your dentist on the options that you've got when you have a filling material. And now you know the process of having a filling on a particular tooth that either has a cavity or has a broken filling, or a combination of both. So until next time, make sure you watch our next video and watch how we do dentistry at View Mobile Dental here in our office.